Thanks for watching AM Northwest this morning. For people who've struggled with weight loss, bariatric surgery can be their best hope for a solution. Here to explain, we welcome back from Oregon Weight Loss Surgery, Dr. Emma Patterson.
Nice to have you back.
Yeah, good to have you with us today. Let's talk about bariatric surgery and what it means exactly. What is it?
So bariatric surgery is weight loss surgery, and it's stomach surgery. So there are various types, but in each of them, we essentially make the stomach smaller so that patients can't eat as much and they're less hungry.
And now at your office, in your practice, you offer a variety of different weight loss procedures. Tell us about that.
Yeah, so really my take on it is I have 3 really good operations for weight loss. If there was one perfect one, I would do it for everybody. But I think we have 3 good ones, and so I educate people on the pros and cons, and for the most part let them choose. And so there's the lap band, which is right here, which is a little device that goes on the stomach. There's something called a sleeve gastrectomy, where I staple and remove about 80% of the stomach to make the stomach into a long, narrow tube. And then there's a gastric bypass, where I make the stomach into a little golf ball and bring the intestines up to it. And so on all 3 of those procedures, I do laparoscopically with very small incisions. And so that's the bypass being shown there, where I make a very small stomach with the staplers. I staple and cut, and then measure down some intestine and bring it up to the little golf ball-sized stomach pouch. And so food bypasses the rest of the stomach. It's left in. And then I have to make another connection from the intestine to the intestine there so digestive juices can meet the food lower down.
How do you decide what surgery is best for what person?
You know, for the most part, like I said, I let people decide, and because there are different pros and cons and risks and benefits to each. And so it's kind of on a bit of a continuum where you have band, sleeve, bypass, with band being the safest and least invasive,
Gotcha.
and sleeve being a little more invasive, and bypass being a little more. And as you add on sort of a little more surgery with each, you get perhaps a little more weight loss or faster weight loss, but maybe a little more risk of complications too, although overall all the procedures are very safe, like gallbladder surgery, say.
I'm assuming people don't come in on a Tuesday and say, I want to do something. They come back Wednesday and it gets done. I imagine there's a program leading up to whatever procedure you determine is best.
Exactly, and so the average person takes maybe 3 to 6 months to get through the program because there's a lot of education involved. We have a really multidisciplinary program where patients see dietitians so they learn what's the best food to eat, particularly when they have a small stomach. They really have to focus on protein. We have them see a psychologist because when your body's changing, losing 100 or more pounds, there can be a lot of relationship changes and psychological issues, for better or for worse sometimes. And we also have everybody see an exercise specialist so they learn how to exercise safely so they won't hurt themselves, and particularly to do resistance training where they can build their muscles.
So do you see them keeping the weight off?
You know, for the most part, it seems that about 90% of patients lose a lot of weight and keep it off, and only a small percent of patients will regain their weight.
But you also see some dramatic results and a dramatic difference in their personality almost.
Yes, it's really fun. I mean, my follow-up clinics are so fun that, you know, a year or 2 after surgery, I often don't recognize the patients because their faces change so much, but I also don't recognize them because their personalities change so much. They're being themselves. They're not feeling like, you know, they're trapped inside this extra 100 pounds, and their personalities just really come out.
It's got to be amazing. Now, you have a free informational seminar, because we obviously can't cover everything in a few minutes here. Tell us about that.
Yeah, so people, if they're interested, can sign up for a seminar on our website at OregonWeightLossSurgery.com. We actually have 2 different types of seminars because patients come from all around, and so they can do a seminar right on the website, or they can come to a live seminar and where I really discuss the program in much more detail and the options for surgery in much more detail. That it takes about an hour and a half, and I stay to answer all their questions. So those are monthly.
Thank you very much. We'll put the information on our screen there in Portland.
And if you'd like any more information about the different weight loss procedures, give them a call, 503-227-5050. And as I know you are happy to answer questions.
Always.
We appreciate it. Thanks for coming in today.
Thank you.
And we'll be right back with more AM Northwest after this.